So guys, by now you are aware of the big beautiful bill and its progress in Congress, which so far so good. I think we've heard that it has passed because last time I checked it was 51 against 50 and it was on its way to presidential assent if I'm not wrong, and it was due for July the 4th, which is actually tomorrow, and Donald Trump is set to sign that bill into a law. And so one of those people, or one of those areas that has been affected mostly, is the Medicaid and Medicare, where senior citizens are gonna have it rough. And mostly people are crying out, and most of the people crying out are senior citizens from the MAGA camp who actually voted for Donald Trump, not knowing that he was gonna slash the Medicaid deal. It seems like either these people were not aware during the campaign, or they were lied to during the campaign, such that they voted for the very person who is gonna slash what they really need. And so in today's video, we're gonna have a detailed conversation about this. Let's have a listen.
Voters in Trump states are mad that Medicaid cuts gonna be devastating to them. Are you crazy? That was always the plan. He told you he was gonna cut Medicaid. He was gonna cut your benefits. So all these people that voted for Donald Trump now saying, oh, we scared we're gonna lose our Medicaid. Yes, you're about to lose it, and you deserve to lose it. You don't need it because you voted the wrong way. You didn't vote for Harris because she was a woman. You voted for Donald Trump because he was a leader. Okay. Caught myself. He's a leader. No, he's not. He's about to take your Medicaid. And I'm happy for you. I'm happy you losing your Medicaid and your food stamps. You don't deserve it. Because if you are crazy enough to vote for a man that says he's going to cut your Medicaid and then cry foul and wolf when he does it, something is wrong with you. I feel shocked. You shouldn't feel shocked. You're getting what you deserve. I only report the news, but I'm happy to say Donald Trump is cutting your Medicaid benefits for everybody that voted for him. So don't cry me no river. Don't cry me no river. We don't want to hear it.
Accomplishes two goals that poll after poll show that the American people overwhelmingly want. Number one, it cuts prescription drug costs in this country by half by having Medicare negotiate prices consistent with what other major countries around the world are doing, something similar to what Trump has been talking about. It uses the $395 billion in savings to do something else that the American people desperately want. Expand Medicare to cover dental, hearing, and vision. In Vermont and all over this country, you got a lot of seniors cannot afford to go to the dentist, cannot afford dentures, cannot afford hearing aids, cannot afford eyeglasses. Poll after poll shows that over 80% of the American people support both of these provisions. I ask for the support of my colleagues.
My mom is 59 years old and she lives in a nursing home. She became disabled after having me, and she's been on Social Security disability benefits since 1992. These benefits pay for her 20 different medications that she takes several times a day. It pays for her nursing care. It pays for the living expenses that she has there. And in April, she got a letter from Social Security stating they had reason to believe that she was no longer disabled and could re-enter the workforce. She's been eligible for disability for 34 years, but now she's capable of working. A resident of a nursing home. Tell me again how these Medicare and Social Security cuts aren't going to affect us.
So McTurtleneck McConnell done poked his little head out, right? And this big, beautiful bill is just such a non-starter, right? Because now the Senate has done their part to it and it only made the bill worse. But when he was recently interviewed and asked about the cuts to Medicaid and how it would impact the people in his state, because keep in mind, Kentucky is one of the poorest states in the country. He said these Republican bills, the big beautiful bill, is a risky bet. But all those people on Medicaid, they will have to get over it. They will have to get over it. They will have to get over losing their Medicaid. They will have to get over losing insurance. When are maggots going to wake up and realize they just don't give a about y'all? It was just about the vote. It was just about keeping power. It was just about making sure syphilitic Sid got into office so that they could do shit that they're doing now. I would like very much for him to tell a cancer patient they'll have to get over it. Kind of like, Journey Ernst saying, well, we're all going to die. And then she doubled down on it and went to a graveyard to re-emphasize the fact that we all going to die. So between evangelicals trying to start a holy war so that we can have the return of Jesus and we're all going to die, now we all have to get over it. Well, they will have to get over it. This is where these people are, and that's how they feel. Now you know, and knowledge is power. Well, for those of us that are not in like the MAGA cult, you know what I'm saying, because knowledge is... Anyway, I'm going to stop there. Okay, bye.
They just want us all to die. They want us all to die so they can use our tax funds, right? That we all contribute to as a slush fund, which is essentially kind of what they've been doing with Social Security, but that's a whole nother topic. But they just want us all to die. And the sooner you understand that, the better off you'll be. Doesn't matter where you fall, the left, the right, middle, far right, far left, it doesn't matter. They want us all to die. That is the point. And yeah, it is what it is. And you people that just cannot get along and see what is happening right in front of us are helping them speed up the process.
As you've heard, this big beautiful thing has really dug into the Medicaid thing, and despite us today talking about the senior citizens, we're just gonna highlight in broad context of how this Medicaid thing is gonna affect the US citizens. I'm gonna give you a quick breakdown of the bill. We're gonna talk about what has been cut. According to the Congress, over $1 trillion in Medicaid has been reduced over the next decade. New work requirements for adults aged 19 to 64, which includes some parents, and also for the volunteers and for people who are studying, should have at least 80 hours a month to qualify for the Medicaid, which also includes limited exemptions. Imagine a senior citizen, like someone between ages 55 to 64, working for 80 hours a week. Is that even normal? Another thing is that the more frequent eligibility checks are gonna be done, and it is gonna be done like from once a year to twice a year, which increases the risk of people losing coverage due to paperwork issues. Imagine for the first 6 months you passed and you've been included in that. Over the next 6 months something happens, then you're out of it. How is it helping the US citizen? There's also the issue of limits on retroactive coverage, where it's gonna be reduced from 3 months to a month before enrollment. God damn. There's also gonna be a stricter asset test where applicants with home equity over $1 million would be disqualified regardless of inflation. That means that if you have over $1 million, you got money. You don't need that Medicaid thing. Just go sort yourself. There's also the issue of co-payments, where the state must charge up to $35 for services for those just above the poverty line. Yeah, regardless of your financial capabilities, they're gonna drain $35 from your pocket. Up to 12 million people could lose their health insurance by 2034, mostly due to Medicaid cuts. Also, rural hospitals and nursing homes may face closures or services reduction due to lost funding. So many people are not gonna be able to afford the nurses that do come to look after them in these nursing homes. Also, children, people with disabilities, and low-income families, who are among the most vulnerable groups.
Cindy Smith, I am a Mississippian. Step to the front. Let's talk about the lie that you posted on social media yesterday. You said that the average Mississippian would see a tax increase of $1,570 if we do not pass the big, beautiful bill, because it's going to be the biggest tax cut in history. And you are right about it being the biggest tax cut. What you are lying about is the amount it will cost the average Mississippian, the average American. It will cost everyone who is earning $400,000 or less. It will cost them more in taxes. How many Mississippians do you really think are earning more than $400,000? Mississippi is one of the poorest states in the country. We receive more in federal funding than most other states. And so instead of getting on here and being accountable for the lies you are telling and being held accountable by your constituents who will lose access to healthcare, who will lose access to their hospitals. Do you know what happens when people lose access to hospitals? They die. If an ambulance has to drive 60, 90, 100 miles to even be able to get someone to a hospital because their local hospital has closed, they die. When I say Republicans are killing people, this is exactly what I mean. And you are bragging about it because you think it's going to save them on their taxes. What you did not say is that the average Mississippian earns $56,000 a year. Do you know what that person that's earning $56,000 a year is going to see in their taxes? An increase of about $300. Do you know what they get for that $300? They would get to keep their health insurance. They would get to keep access to their hospitals. They would get to keep their food assistance. They would get to keep their housing assistance. And do you know how many of your constituents are actually dependent upon those things? A lot of them, because Mississippi is a poor state, because we have poor leadership that will cater to the wills of their corporate donors, millionaire investors. That's what you're doing. You're voting to appease them because they don't want to pay millions of dollars in taxes. We're just going to add $4 trillion to the debt. We're going to kick 160,000 Mississippians off of their insurance. Many more will lose access to healthcare providers and hospitals that could actually help them if something happens, God forbid. And you don't care. You don't care that children will starve. You don't care that people will be homeless. You don't care that our veterans will not receive the services that they are due based on the service they have provided for our country. You do not care. All you care about is ensuring that your corporate donors, that the people who write the checks that fill your campaign coffers, that they're satisfied. Mississippians be damned. But I should not be surprised that you are voting consistently against the constituency that elected you. And just for reference, that would not be me because I didn't vote for this. I did not vote for you. But that does not mean that you do not represent every Mississippian here in this state. In the egregious nature of what you are doing, I'm not shocked. I'm not shocked at all because you said you would gladly attend a public hanging and sit right on the front row. And then when you were called out for it, you said, "Oh, well, I didn't mean it like that." Yes, you did. You meant it just like that. And I realized that maybe a tiger doesn't change its stripes. Maybe she just covers them with a hood.
Whether you believe Medicare and Medicaid are in the bill, they are. Beliefs are an interesting thing because they're subjective. The objective reality is that Medicaid and Medicare are in the bill. And someone in another comment section asked me how it affected me, which is like, I don't worry about just me. We're the party that worries about everyone. But I did say, well, my mom had Alzheimer's, and in 2015, we were looking for a nursing home for her. And guess how much nursing homes that we looked for her were? Anywhere between $8,000 to $20,000 a month. A month. A month. A month. Can you imagine having an $8,000 rent a month? I mean, and 8,000 was not the best place, right? And if we didn't have Medicaid, she would have never been, we couldn't lift her. She was dead weight. We couldn't take care of our mother because she was gone. We needed some help. So I looked up this and I found this nursing home by cost by state and region. And I just want to talk about some points. Okay? For example, it says, per Genworth's cost of care calculator in 2024, the nationwide average daily cost for shared room was $305 a day, and the average annual cost is $111,325. A shared room is important as Medicaid typically will only pay for shared rooms, not private rooms. The range across the country goes from a low of approximately $175 a day in parts of Texas and Louisiana to approximately $1,000 a day in parts of Alaska and California. All right, so let's look at this chart. Sorry, one more thing. Let's talk about Medicare and Medicaid before we get into that. When medically necessary, Medicare will pay 100% of the cost of nursing home care for the first 20 days in which a beneficiary resides in a nursing home. For days 21 to 100, Medicare will continue to pay a portion of the cost, but in 2025, the nursing home resident will have a co-payment of $209.50 a day after 100 days. I wonder why in 2025 that is. Medicare does not pay for nursing home care. Medicaid will pay 100% of the cost of nursing home care for its beneficiaries. However, to be eligible for Medicaid nursing home care, the patient must have limited income and assets. Ballpark limits are assets valued under $2,000 and monthly income under $2,901 in 2025. Furthermore, Medicaid beneficiaries residing in nursing homes are limited to a small monthly personal needs allowance, with the majority of one's remaining income going towards nursing home costs. Medicaid eligibility criteria and P&As are state specific. I want to say when our mother had Alzheimer's, we were immediately told to get our mother's house put in our name because they will go for all of your assets first. So we didn't want to get her house to get taken away. So we had to get it in our name, and it had to be in our name, I want to say, for 7 years. Now, this was Pennsylvania before it was considered legally ours. All right, so let's look at the chart. Okay, so the chart is, I had to do it this way sideways because you couldn't see the whole chart in one image. It's state, region, private room daily cost, private room annual cost, shared room daily cost, shared room annual cost. In the United States nationwide, it is $350 a day for a private room. $127,000 and change for a private room annually. $305 for a private room, a shared room. And annually, that's $111,000. So I know it's small because I had to do my phone sideways, but you can stop at any point when you see your state and look for how much it is. It's out, and can you imagine if you don't have Medicare and Medicaid, what are you going to do? This is monthly and this is daily and annually. You have $120,000 per year to spend on your mama and papa in a nursing home? Don't you want the best care for them? I don't know. We did. We wanted great care. We couldn't afford the most expensive, but we certainly didn't put her in the $8,000 a month one because it smelled like shit and patients were lying around in dirty diapers and it was a hallway. I mean, you better get into reality if you don't think that this Medicare and Medicaid are in the bill. I mean, because then reality is going to hit you when something happens to someone in your family and they need to go to a nursing home.
So while supporters argue that the bill targets the waste, fraud and abuse and encourages self-sufficiency, other people including medical associations, hospital groups and many state officials warn that this could have devastating access to care and increase poverty and medical debt over the next coming decades. The bill still needs to clear the House before becoming the law. We have to look at that, so we're following closely. So the final outcome isn't set in stone as for now. That's why we need to look into that. So how is it going to affect the senior citizens, which is the topic of today and most of the opinions we've had from these videos. Medicaid cuts in the one big beautiful bill could have serious consequences for senior citizens, especially those who rely on long-term care or live on fixed incomes. And this is how we're gonna look at what's at risk for seniors. Well, number one is the nursing home care, where Medicaid pays for over 63% for all nursing homes residents nationwide. With nearly $930 billion in cuts over the next 10 years, facilities as such may reduce its staff significantly, it may limit admissions or even shut down completely. The Home and Community-Based Services HCBS, which has many seniors who prefer to age at homes, but these services like home health aides, adult daycare and transportation are optional under Medicaid. States may cut them first to save money. There's also the issue of tightening the eligibility criteria, where seniors with modest savings or home equity could be disqualified under stricter asset tests. Some may also face, estate recovery enforcement, meaning that their heirs could be forced to repay Medicaid costs after death. There's also the issue of caregiver impact, where adult children who leave jobs to care for aging parents may lose their Medicaid coverage under new work requirements, unless the exemptions those are clarified in extent. Other things that are likely gonna be affected is the rural access, where cuts could devastate rural hospitals and nursing homes, where Medicaid is often the financial backbone. Remember, there's this issue of income disparities between people living in rural areas and people living in urban areas. You expect people living in urban areas to have many channels to get income from, as compared to rural areas who have been compressed to just have like a few channels of revenues, where they depend on that and they do not have more to seek in those areas. What are some of the real world effects that this Medicaid cut is gonna imply? Well, 2 million older adults could lose Medicaid coverage by 2034. There could be longer wait lists for home care and fewer available aids due to workforce shortages and funding cuts. And lastly, increased out-of-pocket costs for services like prescription, transportation, and assisted living, especially if people are gonna take their funds to take care of themselves in future, now that we've seen that they want people to dig deep into their savings. This is a really broad topic which I want us all to engage ourselves in these discussions, and I'm really looking forward for your thoughts or opinions in the comment section down there below, so don't hesitate to drop them. Also, don't forget to go and check the original creators. The links to their videos or usernames have been embedded in the stitch videos as well. Always go on to their TikToks, follow, like. For this channel, make sure you hit a huge thumbs up button, consider subscribing to the channel, turn on post notifications so that you may not miss my next videos. And with that guys, let me meet you in the next one. Peace out.